Good morning, everybody. It is 9:33 a.m. in Boonville, Missouri, Health Without Risk, from my little office in the dining room. So I'm kind of making my classes a little bit different each day, but we're going to go back to how to lose weight, and we're going to talk about why diets work and why they fail. So I mentioned that the other day. I guess it was Monday. Why all diets work and why all diets fail. Well, it's because weight gain has a bunch of different factors. So the crucial missing link in any diet that you're following, and if you've done the yo-yo effect, which most of us have, you'll follow a diet, it works, and then eventually within a year, if not sooner, you're going to gain the weight that you lost back. And so the crucial missing link of this is the fact that obesity, like all diseases or chronic inflammatory conditions, are multifactorial. There's not one single cause of obesity and weight gain. So do calories cause obesity? Partially, yes. Do carbohydrates cause obesity? Yes. But that's not the whole story. Does fiber protect against obesity? Yes, to a degree. Does insulin resistance cause obesity? Partially. Does sugar cause obesity? Yes. And so all of those factors converge on several hormonal pathways that lead to weight gain. The most important hormonal pathway is insulin. And we've talked about insulin, probably 90% behind the weight gain that we experience, as well as cortisol, so chronic anxiety. So low carbohydrate diets reduce insulin. Low calorie diets restrict all foods and reduce insulin. Remember, anything that you put in your mouth is going to spike your insulin. Paleo diets, which are low in refined and processed foods, reduce insulin. Cabbage soup diets reduce insulin. Okay, so reduced food reward diets reduce insulin. The question is, for how long? So almost all diseases that you have, any chronic disease pattern or problem, is not from one specific thing. So think about heart disease. There's family history, there's age, there's gender, there's smoking, there's diabetes, there's high blood pressure, and lack of physical activity all influence, although not equally, the development of heart disease. So cancer, stroke, Alzheimer's disease, chronic renal failure all have multiple factors. That smoking contributes to heart disease does not mean that high blood pressure does not. So they're both factors that are correctly identified as risk factors for development of heart disease. So if you think that one is correct, that doesn't mean the other is incorrect. So in other words, comparing a study of stopping smoking against treating hypertension or high blood pressure wouldn't really tell you a whole lot. So obesity is no different. It's a multifactorial disease. So you need a structure, a coherent theory to understand how all that fits together, just like with any chronic disease, and that's what internal medicine and family practice doctors do. So most of the things that you've read and learned about gaining weight and obesity and metabolic syndrome and insulin resistance and type 2 diabetes feels that you read that there's one single true cause, and that all others are not as important as that one factor. So there's endless debates as to what causes weight gain and obesity. So too many calories, obesity. No, it's too many carbohydrates. No, there's too much saturated fat. No, it's too much red meat in your diet. No, it's too much processed foods. No, it's too much high-fat dairy. No, it's too much wheat. No, it's too much sugar. No, it's too much highly palatable foods. So no, eating, you would lose weight, but that doesn't sustain life. And all of those theories are partially correct. So the low calorie believers argue with the low carbohydrate people. The low carbohydrate movement ridicules the vegans. The vegans mock paleo supporters. The paleo followers deride the low fat devotees. So the low fat standard American diet since 1977. So all diets work because they all address a different aspect of the disease of obesity. And obesity is a hormonal imbalance disease. None of these diets work very long because none of them address the total factor problem of the obesity disease. Okay? So you need to realize that obesity is multifactorial, just like every other disease that we deal with. Okay, so most dietary trials are fatally flawed by tunnel vision. The various trials comparing low carbohydrate to low calorie diets have all asked the wrong question. They're not mutually exclusive. So what if both are true? What if you lowered carbohydrates and lowered calories and got a better result? So there's similar weight loss on both sides of that equation. So low carbohydrate diets lower insulin. Lowering insulin levels reduces obesity. However, any food raises insulin to some degree. We talked about the insulin index a couple of weeks ago. So in the standard American diet, the SAD diet, refined carbohydrates usually make up 40, 50, even 60% or more of the caloric intake from that diet. I saw a Facebook ad yesterday talking about endomorphs, ectomorphs, etc., and what their caloric intake should be based on macronutrients. And every one of them, the endomorph, the ectomorphs, and the mesomorphs, I'm not sure that's correct, all had 40 to 60% carbohydrates in their diet. So if you go to a low-calorie diet, you're probably going to reduce your carbohydrate intake as well. So both of those approaches work. So at Harvard, Professor Dr. Sacks, S-A-C-K-S, confirmed in a randomized study of 4 different diets that that's exactly what happens. Despite differences in carbohydrate, fat, and protein content, weight loss was the same. Maximum weight loss occurred at 6 months. So if you're in for 6 months. And then a gradual regain after. So usually within a year, so 6 months you lose weight, the next 6 months you gain it back. So weight loss differences between individual diets were fairly minimal. So one diet can come off as better than the other for a short period of time, but the difference in weight loss is less than about 1 kilogram. So a little over 1.7 kilograms per pound, so about a pound. So we've all done low calorie and low fat diets. It doesn't work. We've done Atkins. You didn't get the effortless weight loss that was promised, and then you gain it back. So we learned important lessons from all these different diets that have been published, but none of them have been correct. So carbohydrates are only a single factor in a multifactorial disease. So we've done high protein diets, we've done cabbage soup diets, we've done cookie diets. They only address a single factor in a disease that has multiple factors. And then they all ignore the question of when to eat. And we're going to explore that as we go further in this part of this series on weight management. Okay, so sometimes people feel that everything can be eaten in moderation. So it doesn't really address the complexity of weight gain in humans. So it's kind of a cop-out. It's a deliberate attempt to evade the hard work of searching for dietary truth. So should we eat broccoli in the same amount as we eat ice cream? That wouldn't work. Should we drink milk in the same amount as we drink sugar-sweetened beverages? I won't mention any specific ones, but you know what they are. But you are not going to get the same weight loss drinking sugar-sweetened colas as you would drinking whole milk. So we know that certain foods need to be severely restricted. So that would be sugar-sweetened beverages, candy, cakes, pies, other other foods you don't need to reduce in any way. You can eat all the broccoli you want. There's some moderation in diets, including protein and animal meat. Okay, so others have erroneously concluded that it's all about the calories, and we talked about that way about 6 weeks ago. So it's nothing of the sort. Calories in, calories and energy out doesn't work. So eat less, move more doesn't work. So calories are only one factor in a disease that has multiple factors that causes weight gain, obesity, and all the issues involved with that. So caloric restriction has failed for at least 50 years. So go back, back into the early 1970s. And so low-calorie diets have been tried and tried and tried again, and they fail every single time. Okay, so there's other answers to this question that are not really answers. So there is no best diet, or choose the diet that suits you, or the best diet is one that you can follow. So if experts in nutrition and disease cannot figure out the right diet, there's no way a general population person would know that with that nutritional or medical background, etc., physiology. So it's kind of lazy to come up with a single diet and say, okay, this is the thing. Okay, so if you follow the standard American diet, high carbohydrates, more so than fat and protein, is that the best diet since you can follow it? Well, everybody does that, and we have an epidemic of obesity. So if you eat a diet consisting of pizza and sugared cereals, that's not going to work. And then there's experts that are looking for the truth and reaching for an easy and incorrect answer that all diets are equal. Well, that's sort of true because all diets will lead to weight loss. The problem is sustaining the weight loss. So all diets work, do whatever you want. Doesn't work. So in heart disease, you would never consider that type of recommendation from your doctor to be satisfactory. So if the lifestyle factors of stopping smoking and increased physical activity both reduce heart disease, then we would strive to do both. But we would not say the best lifestyle for heart disease is the one you can follow. But in the realm of obesity and weight loss, most of the experts have this exact recommendation. Follow the diet that you can follow, or use the diet that you can follow. So this information is from Dr. Jason Fung's The Obesity Code. It's worth your time reading, and it's easy to read. I mean, there's science in there, but he's written it for the general public. So he brings up the fact, or he brings up the what am I trying to say? He brings up an example of men who are studying trees. So a guy that's looking at a tree trunk says that trees are large and rounded and rough. Another guy's looking at branches and declaring that trees are small and rounded and smooth. And then the third guy's looking at the leaves and says that all trees are small, flat, and green. So all three of those people are at once correct and incorrect, just as each factor in a multifactorial disease is at once right and wrong. Okay, so if you look at heart disease, you can see the tree. In obesity, you cannot see the tree. So calories, carbohydrates, processed foods, sugar, fast foods, fiber, vinegar, fat, protein, and meat are all important factors on the obesity tree. So most diets attack a single part of that tree at one time. So if you look at cancer treatment, there's multiple types of chemotherapy and radiation combined together. The probability of success is much higher with a simultaneous attack to a multifactorial disease. In heart disease, multiple drug treatments work together. I'm treated for hypertension. I don't have heart disease that I know, but I'm at risk. I take 5 different medications to control my blood pressure. So treating high blood pressure may not, or does not mean ignoring the types of different cholesterols that you can measure that may actually signify a future heart disease problem, or looking at testosterone deficiency in men or women, or looking at hemoglobin A1C levels, or fasting insulin levels. And then if you look at challenging problems like HIV, a cocktail of different antiviral medicines are combined to get maximal efficacy for treating HIV. So you really need to address the multi-dimensional problem of obesity. So instead of targeting the leaf on the tree, you have to target the entire tree, the obesity cascade. Multiple targets, multiple treatments. But of course, the low carbohydrate people don't want to hear about calories, meat, or insulin resistance. For them, it's all about carbohydrate restriction. But even low carbohydrate diets contribute to rising insulin levels. So the low calorie people don't want to hear about carbohydrate, sugar, meats, or dairies. For them, it's all about caloric restriction. You can eat ice cream for dinner, according to them, if it has the same amount of calories as a large salad. So rather than compare a dietary strategy of low calorie versus low carbohydrates, why don't we look at both? And that leads into sugar. The first step in losing weight is to reduce intake of added sugars. And I'm talking about refined sugars. So the first step in any weight loss program is to reduce added sugar. So sugar is fattening because it increases insulin immediately and then insidiously over the long term. So we've talked about the long-term effects of high insulin levels. So sugar is made of, sucrose is made of glucose and fructose. Glucose is a highly refined carbohydrate. It will immediately raise blood sugar levels and directly stimulate insulin release. Fructose does not raise blood glucose levels, but it causes insulin resistance in the liver. Go back about 5 weeks and we did a class on that. And we did it again. We did another class on fructose metabolism in the liver about 5 months ago. So over time, insulin resistance leads to higher insulin levels. So specifically, sucrose, table sugar, and high fructose corn syrup are especially fattening. So this is pretty this is not a controversial statement. Everybody knows that. Sugar is empty calories, but it's even more sinister than that. I've told you about a guy I heard 6 years ago spend 1 hour in a lecture at an anti-aging medicine conference talking about how sugar was more dangerous and more addictive than heroin. So sugar is uniquely fattening because it directly produces insulin resistance. There's no redeeming nutritional qualities to sugar. It's a comfort. So added sugars are one of the first things that you eliminate in any diet. Sugar is an indulgence. You're doing it because it tastes good and makes you feel good. It's an addictive substance. So how do you avoid sugar? Well, that's not as easy as it sounds. Sugars are everywhere in processed foods, and a surprisingly large amount of sugar can be eaten without even knowing you're doing it. So the first thing you do is remove the sugar bowl from the table. Just get rid of adding sugar to food or beverages. But most of the sugar that you eat is hidden in processed and refined foods or in the preparation of foods. So there's lots of natural unprocessed whole foods that contain sugar. So fruits contain fructose and milk contains lactose. And then, so there's a distinction between naturally occurring sugars and added sugars. The two key differences are the amount and concentration. So fruit contains far less fructose than processed and refined foods that have high fructose corn syrup. But fruit also has vitamins and nutrients as well as soluble and insoluble fiber, or the pulp. And that fiber is kind of an antidote to the harmful effects of fructose. Okay, so the bulking effect of the fiber reduces gastric emptying time, sugar absorption that prevents overeating because you feel fuller if you have fiber in your diet. So sugars are added to refined and processed foods as well as when you're cooking them, and they're not naturally present in whole foods. So there's potential dangers from that issue. So added sugars may be added in unlimited amounts. There's no upper limit to the amount of sugar that can be added to foods, and it may be concentrated much higher than natural foods and processed foods. So some foods are virtually 100% sugar, and that doesn't happen in nature. Honey may be the exception. Honey is pretty sugary and it's natural. So people that eat a lot of sugar overeat because there's nothing to make you full. They're empty calories. There's no dietary fiber that may offset the harmful effects of the sugar. So the idea is to direct most of your efforts toward reducing added sugars as opposed to naturally occurring sugars. So sugar is almost never labeled as sugar anymore. You can see it, but there's all kinds of names since the FDA started requiring labels on foods in 2006, and pretty much everybody knows that sugar is fattening and bad for you. So the other names for sugar are sucrose, glucose, fructose, maltose, dextrose, molasses, hydrolyzed starch, honey, invert sugar, cane sugar, glucose fructose, high fructose corn syrup, brown sugar, corn sweetener, rice, corn, cane, maple, malt, golden, palm syrup, and agave nectar. And then the latest little thing is natural sugars, and they mean fructose. Fructose is a natural sugar, but it has a different percentage compared to glucose in nature. So the alias names on a food label are there to conceal the presence of a large amount of added sugars to the food that you're eating in a box or in a jar or in a plastic container. And then there's various pseudonyms on the food label, which prevents sugar from being listed as the first ingredient. So an ingredient list may contain 3 different sugars, such as sugar, brown sugar, and corn syrup. And because the sugar content is now split in 3, the first ingredient is listed now as whole grain wheat. Okay, so look at your breakfast cereal box, and you're going to see that. Okay, so the addition of sugar to refined and processed foods has a flavor that makes it wonderful tasting at virtually no cost. Okay, so sauces, cereal offenders, so barbecue, plum, honey garlic, hoisin, sweet and sour, and other dipping sauces, bunch of sugar. Spaghetti sauce may contain 3 to 4 teaspoons of sugar. And that counters the tartness of tomatoes, so therefore you may not taste the sweetness in spaghetti sauce, but it's there. Commercial salad dressings, condiments, ketchup, relish, lots of sugar. Ketchup is notoriously full of sugar. So if it comes in a package, it's probably got added sugar to it, and not the natural kind. So how much sugar can you eat? There's not a right answer to that. So it'd be like saying how many cigarettes are acceptable. So ideally, your intake of sugar is 0. That's probably not going to happen. So what about desserts? So everybody knows what desserts are. You can eliminate them from your diet if you're trying to lose weight. They're mostly sugar in various forms with some flavors added. So cakes, pudding, cookies, pies, mousse, ice cream, sorbets, candy bars. So what would you do for dessert? So follow traditional societies. The best desserts are fresh seasonal fruits, preferably locally grown. I do eat a teaspoon of honey. I've got to find my farmer's market lady. She's not quite to the honey thing. But a teaspoon of honey a day will really make a big difference, and it has to be local to your area. Will really help with seasonal allergies. Okay, so a bowl of seasonal berries or cherries with whipped cream, great way to finish a meal. Nuts and cheeses, great way to finish a meal, and no added sugars. So there's naturally occurring sugars in these, but they don't have the same danger as added and processed and refined sugars. My favorite snack, and Tammy Crabtree, our nutritionist, will back me up on this, is dark chocolate. Has to be more than 70% um, cocoa, in moderation, very healthy. It's made of cocoa beans, does not naturally contain sugar. And if you think milk chocolate's the same, it's not. Milk chocolate and white chocolate, refined sugars. Dark chocolate has fiber, has antioxidants, polyphenols, and flavonols. Studies on dark chocolate consumption confirm that they may reduce blood pressure, insulin resistance, and heart disease. And milk chocolate is basically candy. So the cocoa component is too small to be of benefit. Nuts, great choice for after dinner treats. They're full of monounsaturated fats. They have very little carbohydrates. They're high in fiber, and they increase. They have increased potential health benefits. So macadamia nuts, cashews, walnuts, all okay. Increased nut consumption has been linked in many studies to better health, including less heart disease and diabetes. Pistachio nuts, wonderful, high in antioxidant gamma tocopherol, vitamins, manganese, calcium, magnesium, and selenium, widely eaten in the Mediterranean diets. And a Spanish study showed that adding 100 pistachios daily, which would be expensive, improves fasting glucose insulin and insulin resistance. So, like I tell all the patients and clients that are working on weight loss, I'm not saying you can never, ever, ever eat sugar, but it should be occasional. So, sugary food plays a major role in celebrations like weddings and birthdays, graduations, Christmas, Thanksgiving. The key word is occasional. I never tell somebody you can never have a piece of cake ever the rest of your life. You can never have a piece of pie. You can never have a candy bar. But they're special treats. Like when I was growing up, we didn't have unlimited candy. Although my dad was a Coca-Cola fiend, so we drank Coke at dinner before high fructose corn syrup got into Coke. It was cane sugar and Coke. So you celebrate birthdays and weddings with a wedding cake, with a birthday cake or a wedding cake. You don't, you don't have broccoli salad as a celebratory meal at a birthday, or a big heaping bowl of broccoli. Be healthier. So, dessert should not be taken every day. If your goal is weight loss, the first major step is to severely restrict sugar intake in your diet. So that leads to the Diet Coke, Diet this, Diet that, artificial sweeteners, etc. does the same thing. There was a study that I talked about in class a year ago probably, where they looked at having a diet soda that had aspartame in it. More than one a month increased all-cause mortality, death, by 40%. And that was from, I think, Norway. It was a European study. But artificial sweeteners, so the people drinking the diet soda pop, the diet this, the diet fruit juice, they still are prone to obesity because artificial sweeteners, just the taste, spikes insulin immediately. So sweeteners give the false promise of sweetness without consequence. The only one that I've seen that actually, although it's the taste, so Dr. Fung feels it's the sweet taste that raises and spikes insulin. Stevia does not get into your bloodstream. You can't absorb it. You taste it, but you don't absorb it. So if you were going to pick a sweetener, it'd be stevia. Dr. Fung still thinks that raises insulin levels and spikes insulin. Morning, Shelley. So that's it for today. We're going to do something else tomorrow, and then we'll revisit this. We'll continue on this how do you lose weight on Friday. So It is still cool here in mid-Missouri. I've still got stuff to plant, but it's supposed to be 39 degrees overnight tonight, so I'm waiting until the weekend. I've got most stuff planted, but so I kind of carefully watch. So everybody have a great day. We're halfway through the week. High school's out next Friday for us in Boonville, and then basically for the summer I'll be health coaching for a living. So any questions, messenger me or comment. If you want me to review something in class, let me know. Our Dutch test was from a request from a couple of weeks ago. I had spent a couple of weeks researching that. But we will continue on this little educational journey together. And I'm trying to do a class every day now that my college courses are done for the semester. So have a great day. Have a great day. I'll talk to you later. Bye bye.